Question from Nermeen. I am going through the process for a potential VSG date before the new year with Aviva. Woo! I am nervous but ready. Any recommendations for things that can be done to prepare for now? Nermeen, excellent question. So I actually have a video. I'm sure you'll get it. With your pre-op video, you can actually probably look for it. It's in our video list on our YouTube channel that I've made for pre-op preparation. And it goes through many things in there about, reminders of making sure that you're working on your portion sizes, tracking your food, doing the high protein, low carb diet. I think that helps get those skills to get the most out of the tool. The other thing is that you want to get yourself strong for surgery, if that makes sense. And I actually tell in the video there, the more strenuous activity that you're doing before surgery, and I'm not even saying this from a weight loss standpoint or a discipline or whatever it is, it's literally just from a physiologic standpoint, the way that your body functions or the way your cells function. If you push your body to its limits, like let's say you go sign up for Orange Theory and you just suffer, right? If you're suffering a couple times, 2 to 3 times a week or more, and you're pushing your body to its limits where you're like, your heart rate's going fast. I'm like, man, this is tough. I really feel like I can't, Dr. Vanderwel is the worst. Why are you telling me to do this? This sucks. You are getting coal in your stockings, and from my present this year. If you're in that zone several times a week as you're getting ready for surgery, honestly, surgery will generally be easy compared to that. It tunes up your body, your blood system, your blood chemistry actually, moves, transports good stuff in, bad stuff out better. You increase your natural endorphins, which are natural pain medications. It really does help you get tuned up and ready for surgery. And most people, until I take this seriously, say afterwards, surgery wasn't as bad as all that stuff you made me do ahead of time. So, thanks and no thanks, I guess. But yeah, that is definitely a helpful one. Get some measuring cups. Getting a belly band sometimes is helpful. That's a little band that you can get on Amazon. It'll stretch around your abdomen and just kind of keeps everything tight in. So when you're moving around after surgery, there's not the shear forces that are going in there that are making those incisions more comfortable. And I don't tell people to buy a ton of extra like protein shakes or protein bars, stuff like that, because a lot of people's tastes change after surgery, which is very interesting. It's very interesting that doing surgery in your stomach affects your taste buds. Which shows that there's so many things in here that we don't really understand what's going on and how this whole axis works. So a lot of people, they'll go to Costco and buy out a certain type of something, and then after surgery, like, oh, this is dead to me. So don't go too crazy with stuff you think you're going to need after surgery. Get just enough to kind of get you through, and then figure out what you like afterwards and stock up on it once you're kind of in that mess, in that mode. So I think that's most of the stuff, but you're welcome to check out that video. I think I tell people working on the mindset piece too, going through the bariatric mindset workbook is a really good one. I think that's a really, all that stuff is always beneficial. But Nermeen, we're excited for you. So yeah,